Good day everyone, my name is Alparan S. Adog, BSN1 student of Notre Dame of Taplong College, College of Nursing. So today I will be demonstrating to you the assessment of respiratory system. First is assessment. We have to assess the client's physical and psychological aspect before and during examination. Rationale 2 allows healthcare provider to gather complete data about the client's health status. Ma'am, kamusta pong pakiramdam niyo, ma'am?
Okay lang.
Wala po bang nararamdaman, ma'am?
Wala.
Next is review body areas to be examined. Rationale helps examiner or the healthcare provider to identify which part of the body is to be examined systematically. So today I will be assess for the throat, chest, dito sa side, lateral, both sides of lateral, and then sa likod. Next is planning. Make a physical and make a physical and environmental preparation before examination. Rationally, proper preparation of the environment, client, and equipment ensures a smooth physical examination with a few interruptions. Next is determine and prepare materials or the equipment needed. Rationally, equipment, we are going to use the stethoscope as our equipment. So, okay, your stethoscope will be used to auscultate, and we need also the chart to write and document both normal and abnormal findings of the patient. So now let's move now to the implementation. Identify the client and explain the procedure. Rationale to ensure that the procedure is done to the right patient, to reduce anxiety, and to ensure patient's cooperation. Ma'am, ako po si Alparan, ma'am, ang nurse niyo for today. What is your name, ma'am?
City Arawian.
So today po, ma'am, i-assess ko po ang inyong throat, chest, dito sa both lateral sides of your body, and then sa likod po. Okay lang po sa inyo, ma'am?
Okay lang.
So now, properly position the patient for the examination. Rationale, proper positioning ensures easy access to the body parts of the body parts to be assessed, and client feels comfortable. Next is take the health history of the client. Ask the patient if he or she is experiencing cough, dyspnea, chest pain related symptoms, like for example is edema and fatigue. Rationale to have comparison with previous illnesses and present health condition. Ma'am, kamusta pong pakiramdam niyo, ma'am?
Okay lang.
Hindi po ba kayo inuubo?
Hindi.
Hindi naman po ba kayo nahihirapan huminga?
Hindi.
Wala po bang masakit sa chest niyo or sa likod to?
Wala.
Okay, salamat po. Next is conduct physical examination using the 4 skills in physical assessment, which are inspection, palpation, percussion, and auscultation. Rationale to assess, determine, and identify abnormal findings in the body system. So now let's move now to the inspection for the chest respiratory rate, rhythm, and depth. Rationale to identify any abnormalities based on normal range. Next is symmetry of chest movements to rationally equal chest movements. Next is muscles for breathing. Rationale to know if there is any effort breathing. So now let's move now to the spinal deformities. Rationale to identify any deformities of the spines, scoliosis, kyphosis, and lordosis. So ma'am, tayo lang po tayo, ma'am. Pwede tayo po tayo, ma'am. So as you can see, this is the normal back of the patient. It is actually straight. So now I will show you the deformities of the back, starting with the scoliosis. So as you can see, there is a curve or S formed at the back of the patient. And then so next is the kyphosis. There is a shape form. There is a shape or form at the back of the patient, or para siyang backward and naga-backward sa likod. And next naman is lordosis. In lordosis, the abdominal of the patient is slightly forwarded. So now let's move now to the palpation of the trachea. For the position, rational to check proper position of trachea. So ma'am, sit lang po, upo lang po tayo dito ma'am. So in assessing the trachea ng patient, you must be at the back of the patient, not on the side or in front or or in front. So in this assessment, you are going to you are going to use your fingertips to palpate the trachea for the to assess if there is any problem or masses on the trachea. So you were just going to palpate it and then assess if there is any problem or masses formed at the trachea of the patient. So next is chest for the tenderness and masses. Rationally could be susceptible to have tumor in present. Mamalik lang po tayo doon. So in assessing or palpating for the chest, it could be in bilateral. So you're going to assess the right and left, and you're going to palpate circular motion until makaabot na until makaabot na parang dito na sa near arm of the patient, and never touch the nipple of the patient. So first is we're going to palpate the outer part of the areola and assess if there are masses or any bruises on the chest of the patient. So we were just going to palpate it into circular motion. And then you're going to assess it also if there is any problem or any masses or bruises. And also the opposite side. So next is palpate for the tactile fremitus. Rationally, vibration felt on the patient's chest during low frequency vocalization. So after you palpate the chest of the patient, you are now going to place your palm in the patient's chest, and then you are going to ask in low voice kahit magsabi lang ang patient ng like for example is this one. Ma'am, pwede sabi po tayo ng one more time, ma'am. Yung isa naman po, yung medyo matagal, ma'am. So as you can see, if you're going to place your arm in the patient's chest, meron kang makikita or mararamdaman or maririnig or marinig na vibration coming from the patient chest. So now let's move now to the percussion for chest. You have to percuss the chest and assess for percussion sound. Rationally, to evaluate normal percussion on percussion sounds. So in percussion, in order to check the organs of your chest, like meron kasi tayong lungs, heart, and cartilages. And in order to percuss it, it should be in a circular motion also para ma-assess ng mabuti ang ating patient, and percuss it also kung meron bang nagtitake sa chest. So same with the palpation, we're going to percuss it circular motion. So we're just going to assess for the sound. Same with the opposite side. Next is auscultation breath sounds for the anterior, posterior, and lateral. Rationally to identify and differentiate normal to abnormal breath sounds. So in auscultation, always remember na open or close ang ating bell ng stethoscope, and then you are going to also to check it kung ito ba ay gumagana. So after you check the bell of the stethoscope, or yung equipment, you are going to assess your patient for the for the anterior, for the lateral and posterior. So remember, there is a difference between the two lungs. In a left lung, we have two lobes, and sa right naman is meron tayong three lobes for the upper, middle, and lower. And now, you are going to assess that one by ones. So now I'm going to show you on how to auscultate for the breath sounds for the chest. So let's start first. Let's start first with the anterior, and then moving to the lateral and then posterior. So we're going to assess first for the left side of the anterior. Inhale po, ma'am. Exhale. Inhale. Exhale. Sa lateral naman is two lobes din dito. Inhale. Exhale. One more time, ma'am. Inhale. Exhale. And also this sa ating posterior. Inhale. Exhale. Inhale. Exhale. Next naman is sa right side of the posterior. So dito sa right side, meron tayong 3 lobes sa ating lungs. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Next naman is sa ating lateral. Inhale. Exhale. Inhale. Exhale. Next is sa ating posterior. Tingka. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. So after you auscultate the anterior and lateral and also the posterior, you are now going to compare if there is a difference between the left and the right lung of the patient, kasi baka merong na note na extra sounds. So now let's move now to the adventitious sounds for the crackles. Rationally abnormal lung sounds characterized by a discontinuous clicking or rattling sounds. Next is wheezes, a high-pitched whistling sound made while you breathe. It is caused by narrowed airways or inflammation, like for example is asthma. Next is a ronchi, continuous low pitch rattling lung sounds that often resemble snoring, obstruction or secretions in larger airways. Next is grunting, a sound made by a baby who is having trouble in breathing. Next is evaluation, make findings of health assessment and physical examination done on the client. Rationally, these are important data to convey to the physician to aid in diagnosis of the patient. Next is documentation, record or document and report any pertinent findings found during assessment to appropriate personnel, rationally to provide accurate data in the care of clients. So, okay, what are you going to document in your patient is that if you see any asymmetrical movement, kung hindi balance or equal ang ang kanyang paghinga, and if you heard something like bronchi, wheezes, or etc. And also you're going also to document lahat ng respiratory rate, both abnormal and normal findings of the patient. And that's it for the assessment of the respiratory system. Thank you and have a good day.